Dr. Denise Ejo, the CEO of Cornwall Cancer Foundation. I would like to welcome you to our Cornwall Cancer Foundation page. Our goal is to create an awareness of the challenges, support and guidance experienced in managing cancer care for sufferers, family, carers and friends. To engage with us, don't forget to subscribe to our channel. Click our notification bell.
President of Psycho-Oncology Society of Nigeria, so we'll be handing her back the baton. Good morning, doctor.
Good morning, Adora. Good morning. I think I haven't got your name.
Because I was waiting to see your face. It's been a while I've seen your beautiful face.
Yeah,
so I'm waiting to see it on the screen. It's Ahizoje Momo again.
Yes, Ahizoje.
You can see it now.
Thank you. So over to you.
Good morning. Good morning, viewers, and welcome to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, CEO of Cornwall Cancer Foundation. We are in partnership with AIT, and we are very grateful for this time where we are able to come up and create awareness on cancer in Nigeria today. So, good morning, and thank you for joining us. Thank you for coming on to view as viewers on this program. So today, what are we discussing? I don't want to waste a lot of time because I've got someone very special on the house again, as you know. Today we're discussing the importance of this psychosocial evaluation in cancer care. Let me first say hello to our guest. Doc, I call her Dr. Lizzie. So I'm going to call her Dr. Lizzie. Doc, you're going to have to accept that because I don't like telling lies. I can't start calling you another name. Dr. Lizzie, good morning.
Good morning, Dr. Ejo. Thanks for having me.
Thank you for joining us. So let me start very quickly by introducing Dr. Lizzie. Dr. Lizzie is, let me call her properly. Dr. Elizabeth Akin Odanye is the current president of the Psycho-Oncology Society of Nigeria and a clinical psychologist at the University College Hospital, Ibadan. Her research focuses on psychosocial and behavioral dimensions of cancer, with emphasis on addressing factors that contribute to advanced stages of cancer and how cancer affects the overall well-being of patients and their caregivers. I'd like to say thank you, Doc, for joining us, and I thank you for your very brief but very sharp bio.
Thank you.
So I'm going to first start by trying to introduce this before I start. The psychosocial challenges of cancer patients are something that a lot of us do not realize. The impact it has on our everyday lives because we're more focused on the medicines that go with cancer treatment. However, the life that we live is dependent on everything else. So today in the house, the reason we're having this serious discussion is because of this. So Doc, I'm ready for you. Are you ready for me? Because I got some very serious questions. And trust me, I am coming from a place of sitting on those chairs. So let's go. What does psychosocial mean and why is it important to discuss when treating cancer patients? So let's start basic.
Thank you, Dr. Ejo. Psychosocial has two keywords: psychological and social. And the psychological component of that term also encompasses a lot of several other small terms, like we're talking about emotions of the individuals, talking about their feelings, we're talking about their attitudes, we're talking about their personality, and a whole lot more comes into that psychological component. And then in terms of the social, we all know that we are social beings, and interpersonal context is very, very important to us. And beyond the interpersonal context is also even the intrapersonal context. You know, the interpersonal, we talk about you and the people around you. Beyond the people around you, there's also that relationship with the higher order, which could come in different forms for different people based on the religion that they practice. The social component is also about the social environment that may also talk about the economics, the policies and politics, and a lot more.
Wow. Thank you. That was nice and sharp, but actually you hit a lot of things on the nail. So I'm just going to go. So what are the psychosocial aspects
Yeah, I think
specific for cancer patients, in the sense that, where am I coming from now? I'm coming from the point of our well-being. And the reason I'm trying to narrow it down to this now is because a lot of the time when we talk about cancer and we talk about the treatments, a lot of things are now coming to bear, that there are more needs that we have that are not addressed. And if they are not addressed, as we go through the challenge, we start to fall down. And then the energy or the will or the not physical energy, the mental health, the physical health, the all the other aspects, once not addressed, then how do you fight? So that's where I'm coming from. So what will be the specifics? Now I'm being specific.
Okay. I think it's important to know that a cancer patient is first a human being before he or she is a patient. And as human beings, we have different domains. There is the physical domain, which is the part that is often given prominence in the treatment of cancer. There's always that issue of let's kill the cancer, let's conquer the cancer. But sometimes we do this leaving the person who has the cancer behind. So apart from the physical domain of humans, we have the emotional domain, we have the cognitive domain, we have the social domains. And all of these aspects need to be given cognizance as we plan treatment for patients, because if we focus on only the physical aspect, we lose out. And the patient we may not be able to give the patient the kind of holistic treatment that patient needs. And so we're talking about the psychological component. It's important, for instance, to look at the adaptation of this patient. How is this patient adapting to the news of a cancer diagnosis? Because when it comes to getting a cancer diagnosis, being treated for it, there are lots of uncertainties that goes with it, and patients will need to adapt. And so there's a need for us to assess how is this patient adapting to this issue. And within the psychological component also is the issue of mood. Patients could experience mood swings. They could experience psychological disorders, even though these psychological disorders may not meet the full-blown criteria, to be diagnosed as maybe being depressed, having anxiety or stuff like that. Sometimes they do meet the criteria, but sometimes they don't, because oftentimes these mood changes are related to the situation in which the patient finds himself or herself that is unable to cope effectively with. And then with this psychological too, it happens also across the cancer care continuum, from screening to diagnosis to treatment, survivorship, and or end of life. This psychological component cuts across it, because even at the survivorship stage, when the patient is told, oh, you are now in remission, there's no more sickness, there is still the fear of recurrence, such that every time this patient is going for screening, because there is this at least annual screening to be sure that everything is still okay, there is still that anxiety lurking behind. What would they find? What would happen? This is very, very important to look at. Then other aspect is that relates to the vocational aspect, because whatever affects the physical has a rippling effect on the other parts of life. There's the patient may not be able to function as well as he or she used to. Even if the patient is functioning well, the patient may find it difficult to ask for permission to go for treatment because he's afraid to tell the colleagues or the boss, I have cancer. And that fear of the stigma that may come with that within the work context. There's also the aspect of social functioning. And because cancer is not just a disease of the body, it's a disease of relationship. The patient this cancer occurs in a social context where this patient has family, a spouse, has friends, and oftentimes cancer has been known to on marital relationships, especially if there were prior problems in that marriage. In some other marriages, it could lead to closer bonds, but it is not uncommon to have patients patient spouses divorcing them or separating from them because they have cancer. So this is an important aspect to look at. Recently, I was conducting a study on intimate partner violence in the context of cancer. And, I found out that some patients in this experience are experiencing intimate partner violence because of the psychosocial stress that the spouse may experience, in the context of helping this patient overcome this cancer. Then even in terms of sexual functioning, cancer treatments are rigorous. And sometimes part of the side effects of treatments may be decreased libido. And when we are grappling with ill health, sometimes sex goes to the background. And we know that for couples, sex is an important issue. And then there may also be the issue of fertility or infertility problems that may come up. Another important aspect of psychosocial issues in cancer is their spirituality. Because for some patients, cancer brings with it existential crisis, where they ask the questions, why me, God? Have you abandoned me? And so this spiritual crisis is there and needs to be investigated. Maybe also related to physical aspects is the issue of body image, which could also be psychological. The individual looks, because depending on the type of cancer and the type of treatment that this patient is receiving, there may be amputation of body parts, there may be disfigurement, and issues like that. So this could bring the body image issue. I think I should not also forget to add the issue of financial toxicity. Treating cancer is not cheap the world over. And so financial toxicity is a very, very important component of this psychosocial aspect that we need to look at. Even the policies, around cancer care. How much is psychosocial aspect of care incorporated in the policy of cancer care in any nation goes a long way, because policy actually drives actions in the healthcare system. And so if there's a policy that makes it mandatory for this psychosocial aspect to be recognized and acted upon, then it goes a long way in helping these patients.
Thank you, Doc. I really like this. I really like this part you're coming from, because one of the biggest things that I always try to get through, and sometimes I hope medics don't take it personally, but there's a balance. And I always say that the medical part, the treatment part, is like 30 to 40% of our journey. And most people just assume it's just about taking the treatment, forgetting. A lot of people see me on screen, and most people do not realize I use a walking stick. And I'm always smiling. People don't. And I wasn't using this 5 years ago. Even a year ago, I wasn't using a walking stick. But with time, things are changing. And it's either we get into a sorry for mode, or we get into a let's go for it mode, which is where this psychosocial became a big challenge for this conversation. So I'm going to ask you, so help is needed. Spirituality is playing a very big role, which I am a very strong person, spirituality. So please, However, I think we're at a point where the various organizations need to start listening to this conversation and understand their role, because a lot of people are not taking chemo because of it. A lot of people are not taking treatment because of it. A lot of people are dying because we're just not doing what we are. Medically, I'm not supposed to be here, but I'm here almost 7 years on. So I really am asking here, help is needed. Where will people find help, and how much help is available across Nigeria, bearing in mind the numbers of oncologists you have? I don't even know how many psychosocial oncologists like you are available in Nigeria to meet the 200 million, because the clinical oncologist alone is very, there are now how many in the country? Yeah. Talk me through this.
That's a very important question, Dr. Denise. One thing we want to realize is that help is always available, at least in the form of social support. And so social support will have to do with the quality of the social network around this patient, the quality of the relationships, and the kind of support they can give. Now you talk about spirituality. Apart from giving spiritual support, there is the support that is emotional in nature. There is the support that is informational, providing information. There is the support that has to do with having a companion, having someone to talk to ward off loneliness. There is the support that may also relate to being instrumental support in terms of finances, in terms of maybe paying for a treatment, providing a vehicle to take this patient home, to the hospital, to and fro the hospital. I know that there are some hospitals, most hospitals abroad, in the Western world, they provide transport facilities for patients that may not have such to, navigate the home and the hospital. And so that's also a very important social support that patients can have. But in terms of specifically psychosocial supports that are institutionally based, I don't know how many of them are available in the country. I do know that in the University College Hospital in Ibadan, we have a strong and vibrant, even though still much room for enlargement, available in that setting. And oftentimes we have patients talk about their spirituality and not wanting to take treatments, either because they feel, the perception you have about the origin of the illness will determine what you think would work. And so some patients will believe, I had a dream, and then this cancer came. It is certain that the person I saw in my dream was responsible for this cancer. And so it's better I go the spiritual way. But spirituality goes beyond just going to a church or just going to a mosque or to a traditional healer, for help or for care. Spirituality is within you. Spirituality is a subjective experience between the patient and his or her God, or his or her higher order. And I do not see any religious book that counters receiving treatment. Because sometimes when patients hear of their diagnosis, they'd rather say, no, I will not take chemo, or no, I will not go for surgery. I'd rather go to a mountain to pray, or to an imam, or, or every other alternative care, but this care. But the truth is, the doctors have been trained. The oncologists are trained to treat this disease, and these treatments are evidence-based. So we can add our treatments with our spirituality in terms of prayers, in terms of our faith, in terms of our resilience, in terms of our fighting attitude, our optimism. All these are components of our spirituality. We cannot take them away. We cannot take prayer away from us, especially as Africans. As humans, there is that spiritual connectivity that is very important in enabling us to handle life's difficulties. And so this also in cancer care is very important. I do know doctors that offer to pray with their patients, say before a surgical operation. That's a form of spirituality. But I'll actually not go for spiritual or religious activities that would encourage a patient, for instance, to take herbal concoctions or other things, ingest things that would counter or that may have counterproductive effect on the treatment they are receiving. But spirituality in terms of prayers and all of those other kind of emotional and spiritual strength, having peace, forgiveness, not holding grudges, taking life as it comes, I think it will go a long way in helping.
Doc, you just covered everything, because the last thing I was going to ask you was, what next? And somehow in everything in my what next, unless you have one sentence to add, I really don't know what you want to add to what next now.
Yeah, in terms of what's next, I'll say cancer patients should choose their attitude with intentionality.
Wow, thank you. That is a nice way to end this. I want to thank you very much for joining me this morning, and to the viewers, I think we've actually had a very nice time listening to you this morning. Thank you very much, Dr. Lizzie. It's really nice, and we will be following you on your work and hopefully looking at your papers. I think I'll have a bit more interest in that. And I want to thank viewers once again, for joining us this morning. Together we fight, together we win. You can always find Common Cancer Foundation on any of our social media pages and handles. Subscribe, share, and click the notification buttons. Just share the word, because we need to make sure that everybody can and knows how to find help where you're talking about cancer. Thank you, AIT, once again. Without your commitment to this program, I'm going to say it anytime. I always say we really appreciate you. Your commitment to allowing us to create awareness in Nigeria is awesome. We are externally grateful, eternally, externally, anyhow. Thank you all. Thank you, viewers, and see you again in 2 weeks' time. We look forward to another